And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna, and I have a funny feeling this is going to be one of my longer videos that I've done in a while because we're dealing with a very important topic, Parkinson's disease. This particular video I'm putting together just the day after the former Green Bay Packer quarterback Brett Favre announced that he's been recently diagnosed with Parkinson's disease. He'd still be in somewhat of the early phases of this. But not a very nice kind of thing. And especially, even me being a longtime Bears fan, also a Raiders fan, he broke my heart any number of times. But this is not a condition that I would wish on absolutely anybody. And truth is that there is still no known cure for Parkinson's. But in the same breath, there are a lot of different factors that can go into it that can significantly improve a person's quality of life. That's what I'm going to be jumping into this particular video. First, hitting on a few of the known risk factors that we're aware of, but then also what you can do if either you, yourself, a family member, somebody's recently been diagnosed with Parkinson's so that you can delay the progression of the condition and enjoy highest possible quality of life. So let's go ahead, jump into it. Okay, first thing what I want to get into is just a little bit what is the nature of Parkinson's disease, Parkinson's dementia. It's what's known as a hypokinetic disorder involving the basal ganglia. Basal ganglia are clusters of nerves in the brain that are responsible for coordinating movement in your body. Now you might be wondering, why do I have the little inside out character written right here? Well, if I was going to take the time and walk you through how it is that your brain actually processes not just gross or fine motor movement, but coordinating different things, it's going to get really, really messy, to tell you the truth there. But there's two general pathways in the basal ganglia. One of them is essentially the brake system, and then the other one is essentially the gas or the go. So your brain is going to stimulate the basal ganglia, so we think of it like anger, as I have shown right here, where it's like, we want to go. And what it does is it stimulates different other cells of the brain to basically take the brakes off so that movement can start to happen. And one of these most important centers is what's known as the substantia nigra. The substantia nigra, it is a midbrain structure that produces a neurotransmitter which is known as dopamine. Dopamine is stimulatory and it promotes movement. The problem then with people who experience Parkinson's disease is where that basal ganglia, that substantia nigra, is either so depleted it's not producing dopamine anymore, or the pathway itself is not functioning in the right way, so it's not getting the stimulation messages. So instead of muscles being coordinated so that they're actually going to be moving, they start to become rigid and things start to freeze over a period of time. And this is what we see with the progression of Parkinson's disease, is that people's muscles start to become far more rigid. They are unable to move, and this is going to involve not just the limbs, but the legs. It's going to involve the trunk. It involves the face. Ultimately, it affects everything like that. So think of it like that. It's that instead of being able to take the brakes off, the brakes are just always staying on because there's a depletion of this very particular neurotransmitter known as dopamine. So question is what actually is going to lead to damage to the brain, damage or depletion of the basal ganglia and the substantia nigra in the first place? Well, there's going to be a lot of different factors that are involved here, and I'm going to hit on a few of the common ones. And I'll take it back to Brett Favre as the first example. So one of the most common ones that we are aware of is going to be head trauma, concussion. So as a quarterback, he would have been hit any number of times. And the thing with concussion, you do not always need to lose consciousness. It's any time, even for a moment, that you are seeing stars. And unfortunately, the effects of concussion become accumulative. That is, if you've had one concussion, you're more susceptible to another, and then another, and then another, and another. And over time, what it does is it lowers your brain's resistance to where it starts to become inflamed. We also know this as an example, Muhammad Ali, the former boxer. Well, he had a strategy. It was called rope-a-dope. So what he would do is he would just let people punch him over and over until they fatigued, and then he would actually go on the counter strike and win the match. The kicker is that in the long term, that caused a lot of progressive neurological damage. So one of the first things we need to be aware about is concussion. Second one that I'm going to hit on, this is going to be neck injury, because you cannot hit the head without also damaging the neck. And I'm going to talk about this a little bit later, but in brief, your neck represents a potential chokehold, or a choke point, excuse me, from how the brain is actually able to circulate and how it's able to heal and repair itself. So if the plumbing system inside of the neck, inside of the brain is not working the right way, then same thing. This can lead to the accumulation of damage, accumulation of inflammation in the brain that can be associated with a lot of neurodegenerative conditions. Parkinson's is one of them. Encephalomyelitis, so swelling in and around the brain, post-concussion syndrome, all of these different things related also to the neck. So injuries, very, very important. But there's a third one that I'm going to be touching on in this particular video here. And I was meaning to actually do this video because I came across this concept a little while back, but it was only about a month or so ago where there was a news article that showed up in the mainstream media that's linking a basically risk factor for Parkinson's, and it has to do with the diet, and it has to do with inflammation of the upper part of the digestive system. So let's go ahead and have a little look at that. Okay, here we go. This one, upper gastrointestinal mucosal damage, so the lining of the upper part of your digestive system, and a subsequent risk of Parkinson's disease. What they did was they had a total of 9,350 people who were diagnosed with some form of Parkinson's, and they wanted to see, was there a risk factor with something going on with their digestive system? Previous research had already been done that found that there's a link between the development of Parkinson's and the vagus nerve. The vagus nerve is the nerve that's going to transmit from the base of the brainstem, the medulla, transmits along the front of the neck, and ultimately goes to all parts of your vital life organs: heart, lungs, digestive, reproductive system, the full shebang. In a particular study, what they did was they had taken a bunch of dogs, they severed the vagus nerve, and interestingly, this was the weird thing, they found that not a single dog ever developed Parkinson's disease. So they know that there's some kind of a vagus nerve link here. So they wanted to see, is having chronic inflammation, chronic irritation of the upper digestive tract going to be a risk factor toward Parkinson's? And this is what they found. They found, well, number one, they already knew that people were, more diagnosed with Parkinson's here. So that's going to be where you see the risk factor PD. But then MD, this is going to be referring to, you can see right there, mucosal damage. So there's damage to the digestive system. They found that people who had upper digestive dysfunction of some kind, that they were 4.15 more likely than the resting population to go on to develop Parkinson's. Now, what's also interesting is, I'm not going to read the whole thing aloud here for you, but just want to hit on some of the highlights here. So, number one is that prevalence of Parkinson's has more than doubled in the last 3 decades. That would suggest that something in our modern world is contributing toward this condition that was actually relatively rare going back several years ago. As I had just mentioned, the research done with the dogs, recent animal studies reinforce this concept, showing that the transmission of gut-initiated pathology via the vagus nerve leads to central nervous system neurodegeneration and motor deficits. In other words, something from the digestive system transmits via the vagus nerve and starts to affect the brain. So I'm going to scroll down here just a little bit more through this particular research study to the parts that I wanted to show here. Okay, so they had a look at all these people with Parkinson's, and what do they conclude? The findings of our investigation corroborate our hypothesis that upper gastrointestinal mucosal damage, would be associated with clinical Parkinson's disease development, reinforcing the theory of a gut-first progression in Parkinson's in this group of patients. On this particular chart that I want to highlight right through here, they also wanted to compare people who did not have damage versus people who did. And this is referring to the speed or the decline or the progression of their Parkinson's symptoms. And as you see right here, if people had problems with their upper digestive tract, their symptoms progressed much faster than it did with people who didn't. And again, we don't have a cure for Parkinson's disease, but what I want to illustrate right here, this has to do with quality of life. If you want to be able to live as long as you can at the highest possible level, dealing with the health of your digestive system is going to be very, very important. Now, one of the things that they do hit on is these findings suggest one of two possibilities. First, that the damage serves as the inciting event that could precipitate pathology, misfolding in the gut that goes up to the brain. In other words, the problem starts in the digestive system and works to the brain. The other possibility is that because dopamine is known to play a role in allowing the digestive system to work in the first place, it may be that patients with subclinical dopaminergic signaling, meaning that substantia nigra is not working properly, it's not secreting the right amount of dopamine, signals reduction and then makes it a higher risk of having digestive disorders. In other words, we don't know which one came first. Was it the brain issue that was causing the digestive? Was it the digestive that was causing the brain? We don't know. My personal hypothesis is it's honestly probably going to be a little bit of both. And what it does is it creates a feedback loop where one makes the other worse, then this one makes this work, and it just keeps cycling. So in order to break the cycle, it means you not just have to work with the brain, but you also have to work with the digestive system. Now, there are a few other risk factors, and these are going to get to some of the common warning signs where a person may be able to detect and catch early Parkinson's so that you can treat before it would ever manifest at the worst end stages of the condition. What were a few of these? Number one is what they have written as a CCI, so Charlson Dio Comorbidity Index. Essentially, it's a questionnaire that's looking, are you experiencing motor issues? Are you having issues with how your hands work, how your swallowing is working, things like that. They found that constipation and swallowing difficulties were also more highly associated with the development of Parkinson's. Now, does that mean every single person who has swallowing troubles or constipation at some time in your life is going to get Parkinson's? The short answer is absolutely not, but these do represent a little bit more risk factors. They did also have a look at a couple of other things that were believed to be risk factors for Parkinson's. They're still not good for you, but they found that no, it actually didn't increase the risk. So I do want to, hit on those. So one of them is going to be smoking right here. And then the other one is going to be chronic NSAID, so anti-inflammatories or aspirin use. You don't want to be overdoing either of these, but they found, at least statistically, it wasn't seeming to be a significant risk factor toward the development of Parkinson's. So what does that mean in a nutshell? It means that the health of your digestive system is going to be very important toward protecting against neurodegenerative disease. And there's a few other things that I do want to hit on dietary-wise. One of the other docs in the practice, she just sent me a link for a research article, and I was honestly blown away with this one here. And this is going to have something to do with tangibly, like in the real world. What can you do pretty much right away if you are concerned about developing some kind of neurodegenerative condition? And simply put, what it is avoiding, like the plague, sugar substitutes. Aspartame is the number one big one, the one that you see in all of the diet drinks, but also sucralose, Splenda, phenylalanine, any of these different kinds of substances that work as sugar substitutes, because they are neurotoxic and are actually found to directly link with gastrointestinal and also neuronal damage. So let's have a look at that one. All right, let's have a look here. Aspartame, true or false? Narrative review of safety analysis of general use in products. I've known for a while aspartame not good for you, but I repeat, I was actually blown away reading this particular article. So let me scroll down to the most important parts right through here. Okay, study suggests that aspartame and its metabolites, so what it's broken down to, increase the risk of neurodegenerative diseases such as Alzheimer's, Parkinson's, multiple sclerosis, and brain tumors. Methanol, an aspartame metabolite, causes increased levels of free radicals, resulting in damage to cell membrane caused by perioxidation of fatty acid and the phospholipids, damage to cellular components such as nucleic acid lesions, as well as gene damage and repair resulting in apoptosis or necrosis. What that means, aspartame damages cells. It damages not just cells in the body, but also cells in the brain. It also appears to have a negative influence on the cerebral and the cerebellar cortices. These are going to be the signals that are the centers of the brain that involve balance, equilibrium, mood, sensory, motor, the full shebang. What they found is that people who are taking long-term aspartame, they don't want to have normal sugar, so they're just having diet sugar drinks all of the time. They have increased levels of a certain chemical in their blood that is associated with decreased dopamine productions in the brain. That's the hallmark of Parkinson's. It also is a competitor for glutamate. You remember I showed you that picture with anger from inside out, and I showed you that horrible picture in terms of the brakes versus the gas or the go kind of system? Glutamate is the neurotransmitter that is directly involved with the functioning of that system. Aspartame basically blocks its absorption. So again, it's not always going to be depletion of dopamine, but simply put, if the center of the brain that's responsible for producing that isn't getting the signal to make it in the first place, then you're going to have the exact same end result. And what they also find is that long-term aspartame use actually contributes toward the development of amyloid fibrils, which are associated with Alzheimer's disease. Parkinson's is a little different. That's going to be a tangle which is known as an alpha-synuclein. But one way or another, when you start to have the accumulation of these abnormal proteins inside of the brain, it's going to affect the way that the brain is working. So what's one of the first things that if you have any concern about a neurodegenerative condition, you have got to stop taking diet drinks, sugar substitutes, because these are really, really bad things for you. Now we're going to hit on one more thing that I alluded to earlier, not just the health of the brain, but also the health of your neck, because as we had said previous, the neck is essentially going to represent the plumbing system that allows your brain to be able to clear debris out of the system. So imagine, if you would, that you've got something that's essentially disrupting the normal function of the plumbing system in your house. Sewage is going to start to accumulate and flow backward. Well, if you're not being able to drain blood, fluids, debris from your brain properly through the neck conduit, then this can lead to the accumulation of all of that stuff on the inside and also contribute toward these kinds of conditions. Now, I'm not going to read this particular research article here for you, but this is arguably one of the most important articles, in my opinion, that's been written in certainly the last 10 years. The role of craniocervical junctions, so this is the upper neck, in craniospinal hydrodynamics and neurodegenerative conditions. So, reading ever so briefly, the craniocervical junction is a potential choke point for craniospinal hydrodynamics and may play a causative or contributory role in the development and progression of neurodegenerative diseases such as Alzheimer's, Parkinson's, MS, ALS, as well as many other neurological conditions. This is an excellent article. I'll give you a brief summary in just a sec, but as I scroll through it, I want to show you that even in its mere 13 pages, right there, that the author, Dr. Michael Flanagan, has accumulated over 257 different references. In other words, a lot of work, a lot of forethought has gone into this to illustrate what the neck actually has to do with, in my opinion, not the cause of, but a contributing factor towards neurodegenerative conditions. So let's give a little bit of a brief summary in terms of why that is. Okay, so we've come back over to one of these kinds of pictures. So firstly, what I'm illustrating here on the left, this is the protective layer that separates brain tissue from the circulation of fluid around it. Your brain is meant to contain a barrier like this so that only very selective substances can get through that barrier. Water, oxygen, little bits of sugar, electrolytes, or sodium, chloride, different kinds of things like that. The problem is if we've ever have damage to that particular area, and that can either happen through physical injury, or it can also happen from the accumulation of bad stuff from the environment. So this can include those neurotoxic chemicals such as the aspartames. This can include different things such as heavy metals, insecticides, pesticides, all of that sort of stuff that may happen if you grow up in an industrial area, on a farm, different things like that. That tight barrier can start to become leaky. As a result, things can start getting into the brain system and start to pollute it from the inside out. That again leads to the accumulation of damage over a period of time and can set us up for brain problems later in life. So that's the first part of the story. But the second part of the story that I illustrate here, picture that I reference in a lot of my videos, is that the drainage pathway for your brain is going to be from two primary mechanisms. The first one is going to be the internal jugular veins that run down the front of your neck right through here. And then the other ones are what are known as the cerebral spinal veins that exit through the back of the skull and transmit through the vertebrae in your neck directly. Now, here's the thing, is that because of venous pressure and the way that it actually works, when you are in a seated or an upright position, the internal jugular veins, which are very large, they close about 50%, which means that the primary drainage pathway needs to go out through the neck. However, if a person has ever had a neck injury, whiplash, and even if there are not broken bones, bleeding, or bruising at the time, if there's damage that's on the inside, this represents where fluid is not able to drain properly. And veins in the brain are unique because they don't involve valves like everywhere else in the body. This means then that as you would have a reversal of the normal fluid gradient, it can start to accumulate inside of the head. And oftentimes, what do people say? I feel pressure behind my eyes, I feel pressure at the base of the head, but I feel better when I lie down. That is a telltale sign something is not right with circulation in the head and that the neck is actually involved. So that's just a little bit of a brief summary of the different factors that we know are involved with Parkinson's and the development of it. There's dietary component, there's chemicals we've been exposed to, and then there are physical injuries of the head, but also the neck. So what I'm going to get into in the next part of this video are going to be a few of the early warning signs that means you need to take heed of these, but also some of the different things that if you have been diagnosed with Parkinson's that you can do, again, maybe not to stop the condition, but to minimize its impact so that you can live life the best quality that you can for as long as you possibly can. All right, so some of the early signs of Parkinson's disease. One of the first ones is going to be lack of affect. It's what's called a masked face. It's where a person, and I mean, I have a little bit of this too, where I'm not very emotive in my face, but it's like all the time they don't really have facial expressions, or more importantly, they did, but now they are not expressing things quite as much. So you would notice a change in a person's demeanor over a period of time. That's number one. Number two, anosmia, lack of smell. This is one of the easiest things that a person can screen for. There are a few aromas that people can identify pretty good. Mint is one of them, licorice is another one, coffee is another one, but then so is peanut butter. If you were to take a person and you say, okay, we're going to see if you can smell a certain substance, and you bring it up under their nose, and let's presume also that their sinuses are clear so that they can actually breathe. If you cannot smell substances, this is a sign that there is a circulation inside, or circulation problem inside of the head. It can be associated with a lot of different things: increased intracranial hypertension, allergies, as I said, long COVID. And again, it doesn't mean that somebody who experiences a loss of smell is going to go on to Parkinson's, but it's when you start to add up all of these early signs, if they're kind of pointing you in a certain direction, ooh, that's where we need to pay heed. So if a person, simply put, you waft it under their nose, but they cannot smell these things, that's a sign something is not working right in the upper part of the brain. The next one is going to be no movement. So this is where people may experience frozen shoulder, frozen joints in their body without having injury. It's just, for one, it's like suddenly I couldn't move my joints. Or what you start to see is rigidity, or where a person, when they're at rest, they start to have a bit of a tremor like this. Sometimes a tremor can be physiological, so there's a genetic component, ever so slightly different, but the hallmark of Parkinson's is where you see kind of the thumb always going like this, or where there's rigidity in the joints, so they're moving around and then they just suddenly freeze. Very simple test that you can do like this is you have a person hold their hand like this, and you tap the fingers together like this. So you make an L, and you tap like this 10 times as fast as you can. Hallmark of a Parkinson's is where you would see it start to slow down, or where they would freeze and just find that they weren't able to do that. Because of that brakes gas system, you've challenged the brain to the point of fatigue, and that's where you can actually see it. So this is a very easy screening test that you can do to see if there's going to be some kind of a risk for Parkinson's. Insomnia. People just have trouble sleeping. I repeat, just because you may have a sleeping issue does not necessarily mean you're going to get Parkinson's. It's when you look at it in terms of all of these things right here. And then the last one, constipation. As we showed you, there is a dietary link with what's going on between the brain and between the gastrointestinal system that can lead a person to have chronic, constant constipation. If a person's dealing with 3 or 5 of these different things, ooh, that's probably worth making some changes and having some chat with your doctor to make sure that you'd be able to catch this early on so that you don't have to go downhill as fast on the other side. Now, the last part of this video is where I want to give people some treatment options, and I want to give hope. I don't believe in false hope, first and foremost. So, repeating what I've said a few times in this video, medical science, we don't have a cure for Parkinson's at this point in time. But there are a number of things that we know that can help so that you can live life on your best terms. So, what's one of the first things and first people you need to work with? You need to work with a neurologist. Neurologist is able to best grade and assess the nature of Parkinson's, and they're going to prescribe what's known as L-DOPA or one of its derivatives. In brief, this is a synthetic type of dopamine as a neurotransmitter. Think of it to a certain degree in the way that a diabetic, a type 1 diabetic, needs to take insulin. People, when that basal ganglia is no longer working the way that it should be, they need dopamine from an external source so that they continue to move, operate. Time and a place for all medications. This one here, as an example, this is a life-saving, life-changing drug. So in my opinion, one of the first things that you do before anything else, you go see a neurologist, and if you're diagnosed, if you truly do have Parkinson's, this is definitely going to help you out. Now, after that, because of the dietary component, you want to be working with a good, qualified naturopath who is probably going to recommend a number of different things. Number one is going to be a heavy metal detox, kind of as I had shown you, whether it's been a pesticide, an insecticide, industrial chemical, or a heavy metal. If it's caused damage to that barrier, you need to be able to get that stuff out. So you've been bitten by a snake, yes, get to the hospital, but then you need antivenom to get that out of you. A heavy metal detox, a little bit beyond my area of expertise, but you go through a protocol like that, that helps rid the body of so many bad things that it gives your body the best opportunity to actually heal and repair. What you're also going to need then is you're going to need to make sure that you are actually taking supplements that stack the deck in your favor for brain repair, higher brain function in no particular order. High doses of omega-3, high doses of vitamin D, and then liposomal magnesium and liposomal vitamin C. What's liposomal? Well, magnesium and vitamin C in their normal form, they're water soluble. So you take the supplement, you end up peeing it straight out. If you take it in a fat soluble, liposomal form, it's actually absorbed into your body, and because your brain is made of cholesterol, it's made of fat, that supplement's actually able to be transported and used in the parts of your body that are needed. One that I missed on here is also high doses of creatine. That can make a big, big difference, again, in terms of restoring overall brain function and giving it the raw materials it needs in order to be able to heal. In addition to that, you want to make sure that you are no longer putting inflammatory stuffs into your diet. You don't want sugar. You don't want sugar substitutes even more. And you want to be basing your diet on things that for you, based on your genetics, your anatomy, your life circumstances, foods that you're sensitive to, do not produce inflammation in your body. You want the kind of stuff that is going to be good for you. So alcohol, sugar, all of that sort of stuff, it's got to go if you want your body to be able to actually heal. So that's the nutritional side of it. Now the functional therapies, this is making sure that your neurology is capable of working as good as it possibly can. So a few people to be working with here. Number one, a functional neurologist. That simple principle. If you don't use it, you lose it. You have to still engage your brain in different ways to make sure that the pathways stay open so that continue to operate at the highest possible level. Additionally is also going to be a concussion or a vestibular physical therapist, because by doing different, especially if you've had previous head whiplash injuries, you need to make sure that the brain is able to function and wire itself at that highest possible level so that it minimizes the decline. The brain will find clever ways to adapt for bad circumstances, but you've got to do the exercises in order to get those breakthroughs. And the last one, this is the upper cervical chiropractic side of the equation. So that circulation to and from the brain, making sure that those pathways are open so that the neurological rehab can work as good as it can, so that the supplements and all of the other dietary things that you're doing are able to work as good as they can. So on this particular chart here, what I think that you see is that there's a lot of stuff that's going on. No one of these specialists has all of the answers, but instead it requires a team-based approach so that you can have 10% improvement here, 10% improvement here, 10% improvement here to make that biggest possible difference. So there's a lot of moving pieces, but every little bit that you are able to makes a big difference in terms of your overall prognosis and being able to live life the way you want. So that's kind of our little bit of the wrap up on Parkinson's. Again, some of the different what happens, the risk factors, but also the tangible things that you can be looking at doing right now so that you can slow the progression, so that you can still enjoy life the way that you want. So thank you guys as always for watching. I do hope you found the video informative, educational, but also a little bit entertaining here as well. So if you've got that friend, family member, client, colleague, whomever you think could benefit from watching this, please do share this video with them. Make sure you also click that like and subscribe button so that way other people can find this information as well who are looking for it. And if you've got any particular questions or how you might be able to help, if you live in either the inland Northwest or if you live in the greater Idaho regions or the Northwest Pacific area, we'd be happy to help in any capacity we can. You can reach out to us through our practice at clearchirospokane.com. You can also check out any of the other YouTube videos that we have here on this channel. So thank you guys again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well. Till next time, take care. Bye-bye.